Welcome to the USMLE Step 2 Success Podcast. I'm Dr. Rajani Katta, author of Success on the Wards, and in this podcast, I share clinical cases with targeted teaching points. This podcast is not affiliated in any way with the National Board of Medical Examiners, and cases and teaching points are not meant to serve as an official study guide or medical guidance. I've been a faculty member for over 2 decades, and during that time, I've advised hundreds of residency applicants. I know how important standardized test scores are, but I always emphasize to my students that they're just one piece of the puzzle. It's very important to learn how to succeed and do well during your time on clinical rotations, not only because of grades, not only because of your educational experience, but also because that forms the foundation for your letters of recommendation and for the comments that go into your dean's letter. If you'd like to learn more about how to succeed in the residency match, you can sign up for a free 100-page excerpt of my book on our website, thesuccessfulmatch.com. As you're getting ready to see your first patient of the day, the nurse walks in and tells you that your first patient is ready to go, but she wants to give you a heads up because it's a patient who's angry. As you review the chief complaint, it is facial pain, nasal congestion, and a runny nose. As you walk in to talk to the patient, she is angry. She's a 40-year-old woman, and what she tells you is, I had facial pain, I had nasal congestion, I had a runny nose for 6 days, and when I went to my local urgent care clinic, they said it was just a virus and they wouldn't give me antibiotics. Now I've had symptoms for over 2 weeks, and I still have this facial pain. But now my nasal discharge is discolored, I've got post-nasal drip, and I've developed a fever. I really think you need to give me antibiotics. As you're listening to this case, I hope there were several things that stood out to you. But the first question we want to ask is, what is the most likely diagnosis here? And given her constellation of symptoms and complaints, the most likely diagnosis is acute bacterial sinusitis. And the next question that I would ask you is, what is the next best step? Would you do testing first, or would you just do what she asks and just give her the antibiotics? Well, when you're dealing with acute bacterial sinusitis, most of these cases are made by history and physical exam. So you don't necessarily need to do any further testing. You need to really focus in on her history and physical exam. And some of the key findings that she's describing here are facial pain. Sometimes this is unilateral, sometimes it's localized, sometimes sinus pain can also be referred, but facial pain is a characteristic finding. Sometimes your patients will report that it is facial pressure that is worse when bending over, but that facial pain is a good clue. However, when you're looking at the diagnosis of acute bacterial sinusitis, there's not one symptom that has high sensitivity and specificity by itself. So you're really looking at this all taken together. And in this case, the key findings were facial pain, the purulent rhinitis, the fever, and the duration of symptoms. So in this case, the next question, that we have to answer is, what's the next best step? Well, one of the keys to deciding treatment is the duration of the symptoms. If symptoms are present for less than 7 to 10 days, the cause is most likely viral. And in fact, if you look at treatment algorithms, in general, if it's less than 7 to 10 days, the treatment is symptomatic treatment only because it's most likely to be due to viral causes. If you have symptoms for over 1 week, then you need to start thinking about a bacterial cause. And in this case, she's had symptoms for over 2 weeks. And along with the fact that she has that purulent discharge and the fever, you're really thinking about acute bacterial sinusitis. So the treatment in this case would indeed be to start antibiotics, which just highlights the point that sometimes the patient is right. And for treatment here, the goals of treatment are to reduce her symptoms and to provide appropriate antibiotic coverage for the potential pathogens. In terms of symptomatic treatment, analgesics to help with her facial pain, possibly nasal decongestants. Not all sources agree on this point, but most of them do agree that nasal decongestants may be helpful to promote sinus drainage. And then we need to talk about the use of antibiotics. So in general, when you're talking about criteria for using antibiotics in the presence of acute sinusitis, well, you're going to look for symptoms that are greater than 10 to 14 days. And one other criteria would be severe symptoms of acute sinusitis, such as fever, purulent discharge, and facial pain. So she meets the criteria, and now we need to choose the right antibiotics. So in this case, you need to know what are the most likely pathogens. And the most likely pathogens here, there are three most likely. The most likely are Streptococcus pneumoniae and Haemophilus influenza. After that, also in those top three are Moraxella catarrhalis. So now you need to choose your appropriate antibiotic regimen. Most sources are going to say that amoxicillin and clavulanic acid is going to be a great initial treatment. You might also consider doxycycline or trimethoprim sulfamethoxazole. You might also think clarithromycin or azithromycin. And in general, it's going to be similar first-line therapies for both sinusitis and otitis. So amoxicillin and clavulanic acid. What they found is that efficacy at this point in time appears to be the same as newer quinolones, so you can still stick with that amoxicillin and clavulanic acid. What if your patient was penicillin allergic? Could you use erythromycin? Well, nowadays, erythromycin does not have good enough coverage for Streptococcus pneumoniae due to erythromycin resistance, so erythromycin would not be a good choice. If one of your other options was linezolid, would you consider that? Well, no, because linezolid has great gram-positive coverage, but it does not have good enough coverage for Haemophilus influenza, which is a gram-negative rod. So, really stick to that first line with the amoxicillin and the clavulanic acid. Now, let's say the next question that's asked on the boards is what would be your first diagnostic test? Well, we know in order to make the diagnosis that it's based on history, physical exam, but let's say you've got recurrent infections, or let's say it's non-responsive to multiple courses of antibiotics. Well, now you need to think about further diagnostic testing. And the best initial diagnostic test would be a CT of the sinuses. If you have these where you've got recurrent infections or they're not responding, or if you're, at this point now you might be considering another diagnosis, you need to confirm the diagnosis, then you can consider CT of the sinuses. You would not do an X-ray because that has a low sensitivity and a specificity. You would also not choose the option to culture nasal discharge because that's not helpful in diagnosing sinusitis. So those would not be good options. What if the test, instead of asking you what is the first diagnostic test, what if the question said, what is the most accurate test? Well, that's a different question altogether. Because remember, anytime you're dealing with an infectious disease, then you need to identify the organism as the most accurate test. And an imaging study is not going to help you identify the organism. So if the question asks, what is the most accurate test? Well, that's going to be either a sinus aspirate or a biopsy, because you need to identify that specific organism. So to recap, you had your 40-year-old patient who was angry because she had gone to her local urgent care clinic when she had symptoms for 6 days with nasal congestion and a runny nose and facial pain. And they probably diagnosed her with a viral sinusitis and just gave her symptomatic therapy. And at that point, that would have been the appropriate treatment, because at that point, she didn't have enough signs and symptoms suggesting bacterial sinusitis. Now she comes to you and she's had symptoms for over 2 weeks. So she's got a duration that's making you suspect you might be dealing with a bacterial sinusitis. And in addition to that, she still has the facial pain. Now she has a purulent nasal discharge and she has a fever. So that constellation is bringing you to that diagnosis of acute bacterial sinusitis. And this is a diagnosis that's made by history and physical exam. So that's enough for you to start initiating treatment. They might suggest transillumination of the sinuses, but it's not a sensitive enough test. Even if you did transillumination of the sinuses and you didn't see anything, that would not exclude the diagnosis. You would still be able to make the diagnosis of acute bacterial sinusitis just based on that history and physical alone. Now, the next best step, you don't need imaging. The next best step is treatment. And that would be symptomatic treatment with your analgesics and probably decongestants and antibiotic coverage to cover the most likely pathogens of acute bacterial sinusitis. What are those most likely bacterial pathogens? Well, the top 3, Streptococcus pneumonia, Haemophilus influenza, and Moraxella catarrhalis. So then you're going to choose your antibiotics based on the fact that it's most likely these 3, and that's going to be amoxicillin clavulanic acid, or doxycycline, or trimethoprim sulfamethoxazole, or clarithromycin or azithromycin. You are not going to choose erythromycin, and you're not going to choose linezolid. What would be your initial diagnostic test? Well, this is only needed if you recurrent infections or it's non-responsive to multiple antibiotic courses, and now you're considering another diagnosis. And that initial diagnostic test would be a CT of the sinuses. It would not be an X-ray, and it would not be a culture of your nasal discharge. But read this question carefully, because if the question asks for the most accurate test, remember, if you're dealing with any type of infectious disease, the most accurate test requires identification of your organism. So the most accurate test would be a sinus aspirate or a biopsy. So in the case of your 40-year-old angry patient, you explain all of this to her, that the initial diagnosis and management was based on what you're hearing, likely entirely reasonable. But at this point, you are suspecting a bacterial infection, so you are going to write her a prescription.